All right, so get this. We're going to be diving into some research today on this thing called prone positioning.
Hmm.
And, at first glance, it sounds, well, a little out there.
Or
Basically, it's this idea of taking patients, like really sick patients who are on ventilators, and flipping them onto their stomachs.
right.
And you'd think, like, instinctively, wouldn't you want to be on your back if you're struggling to breathe?
Yeah, you'd think so, wouldn't you? It's not exactly how we usually picture someone who's really unwell, is it?
Not at all. So what's the deal with this whole flipping over thing? When we're talking about, like, comfort, that's one thing. But this is serious stuff, right?
Absolutely, you hit the nail on the head. We're talking about patients battling severe ARDS, acute respiratory distress syndrome, to be precise.
Okay, so we're already in, like, the big leagues of lung problems here.
Exactly. These are the folks whose lungs are really in a fight for their lives. And, well, turning them onto their stomachs, it can actually be a game changer in their recovery.
Okay, so help me understand this. What is it about prone positioning that's so impactful? Like, what's the science behind it?
So picture this, right? With ARDS, the lungs are like, well, imagine a battlefield where everything's gone kind of haywire.
Okay, got a visual.
Gravity is pulling all of those fluids and blood downwards. And then on top of that, you've got the ventilator pushing air in.
Right. Oh, wow. So it's just this very unbalanced situation going on.
Exactly. It's like some areas are getting way too inflated while others are barely getting a puff of air. And that creates a ton of strain.
So it's like trying to, I don't know, inflate those long balloons, but they're all jammed in a container that's way too small, like a game of Tetris gone wrong.
That's a fantastic way to put it. A messy, messy game of Tetris. And that's where our friend prone positioning comes in.
Prone positioning, or PP, as I've heard it called.
Exactly, PP. It's all about helping to redistribute the pressure within the chest cavity. So it's a bit more, even Steven, giving those struggling areas a fighting chance.
So less about comfort, more about making sure those lungs are working as efficiently as possible.
You got it. Now, here's where it gets really interesting. Research, even going way back to some studies on pigs, actually shows that PP doesn't magically make the lungs stretchier, overall.
Huh. Interesting. So it's not about, like, increasing lung capacity or anything.
Nope, not really.
Yeah.
The magic, and this is what's so cool, is that it really impacts where the air from the ventilator is actually going.
Oh, so it's like instead of that air just going willy-nilly, prone positioning's like, nope, you're going over here where you're actually needed.
Precisely. We're talking about recruiting more alveoli, those tiny air sacs, responsible for oxygen exchange to join the party.
It's like directing traffic in the lungs.
You could say that.
Okay.
And there was this study, probably decades ago now, on 21 ARDS patients. It showed that even though the overall, how should I say, the stretchiness of their lungs didn't really change, the way the air was spread around in there, that was completely different, in a good way, of course.
So more oxygen getting to where it needs to be.
Exactly. More oxygen doing its job, and that's what these patients desperately need.
That's wild. Okay, so we're not just forcing more air in, we're making sure it's going to the right places. It's all about efficiency.
Efficiency for survival, basically.
Which, let's be real, is the name of the game when you're this sick. Now, if your researchers were already looking at this, decades ago, was it something that, like, doctors were already using regularly back then?
Well, it's funny you should ask that.
Oh.
Yeah, because even though those earlier studies, the ones with the pigs, they were definitely on to something,
Right.
prone positioning, it
Mhm.
wasn't exactly like standard procedure for a long time.
Right.
It wasn't like doctors were flipping every sick patient onto their stomach.
So what was the turning point? Why aren't we all demanding to be flipped over next time we have a sniffle?
Well, for starters, this is definitely not for your average cold, right?
Good point.
We're talking ICU level stuff here.
Right, the big leagues.
Exactly.
Yeah.
But you're right, something did change the game. There was this landmark study, and you might have even heard of it. It's called PROSEVA.
PROSEVA, yeah, that does ring a bell. Okay, before we get into what they found, can you give us a little background? What was it about PROSEVA that made it so important?
So imagine this. Before PROSEVA, using prone positioning, it was kind of like, how should I put it?
Like the Wild West.
Yeah, exactly, like the Wild West of ADS treatment.
Mhm.
People were using it, but it was all over the place, no real standard for how long to do it, or even who to use it on.
Okay, so not exactly a recipe for, solid evidence-based medicine.
Exactly. But then PROSEVA came along, and they were all about bringing some order to the chaos, if you will. They weren't just going to study any AS patient. They were looking at a very specific group.
Okay, so who are they focusing on?
Patients with severe ADS.
So the sickest of the sick.
Exactly. We're talking about those whose lives were really hanging in the balance. Their oxygen levels were critically low.
I see.
Doctors, they use this value called PaO2 EVIO2, which sounds complicated, but it's really just a way to measure how bad the ARDS is.
Okay, so a way to gauge the severity.
Exactly. And in PROSEVA, they only included patients whose PaO2 was at a certain level or below.
Meaning they were in dire straits.
Precisely. So they're really honing in on this very specific, very ill group of patients, which is really important to keep in mind. And on top of that, they also changed up how long they were keeping people in the prone position.
Oh, interesting. So longer durations.
Much longer. Instead of just a few hours here and there, they were doing these extended sessions, sometimes around 17 hours at a time.
Wow, 17 hours. That's a long time to be on your stomach.
It is. And it was a big change from how it had been done before. But they wanted to really see what this technique could do, put it to the test.
So stricter selection process, longer durations. It really sounds like they were raising the bar for prone positioning. What did they find? Did this more rigorous approach actually make a difference?
Okay, so get this. PROSEVA showed a significant reduction in mortality for the patients who got prone positioning,
Wait, a reduction in mortality meaning?
meaning they were less likely to die from ARDS.
Wow, that's huge.
Right. It wasn't just a small improvement either. It was statistically significant, which is what scientists get really excited about.
Rightfully so. So we're not just talking about, like, making someone more comfortable. This is about increasing their chances of survival.
Exactly. And that's why PROSEVA was such a game changer. It showed the world that prone positioning, it wasn't just some optional add-on. For severe ADC, it could actually save lives.
It's amazing how one well-designed study can change everything.
Totally.
Like, it makes you realize how powerful research can be. But, okay, I'm curious. Besides improving survival rates, did they find any other benefits to prone positioning?
Yeah, it makes you wonder, right? Like, if it's having this big of an impact on survival rates, are there other ways it's helping these
Oh,
patients?
absolutely. Think about it. When you improve someone's breathing, especially someone this sick, the effects are going to be felt, throughout their whole body.
It's all connected.
Exactly. And one area where we see this really clearly is in, well, it's a bit of a mouthful, but it's called hemodynamics. Hemodynamics, right. Okay, so we're talking about blood flow, how the heart's doing, all that jazz.
Yeah, got it. It's like by turning someone prone, it's almost as if we're giving their heart a little vacation. It actually reduces the resistance in the blood vessels, so the heart doesn't have to work as hard to pump blood effectively.
Oh, wow. So it's like taking a load off for the whole cardiovascular system.
Exactly. And for these patients who are already at risk of heart complications, that can make a world of difference.
That makes sense. So less strain on the heart, better circulation. It's like giving the whole body a bit of breathing room, so to speak.
I like that. Breathing room for the whole body. And it's not just the physiological benefits either. There's a very practical side to all of this, especially in a busy ICU setting.
Right, because let's not forget, we're talking about patients hooked up to all sorts of machines and tubes and things.
Exactly. And all those lines and tubes, they can be a real pain, literally.
Yeah.
But what they found is that when a patient's more stable in the prone position, there's less chance of those things getting tugged on or, accidentally pulled out.
Oh, that's a good point. I hadn't even thought of that.
Right. So less disruptions, lower risk of complications, and let's be real, a little less stress for everyone involved, the patient, the nurses, the doctors.
It's like PPE helps bring a little bit of calm to what can be a very chaotic environment.
Exactly. And speaking of chaotic environments, I know we were talking about how prone positioning was used a lot during COVID. And I think it's worth mentioning those, extended prone positioning sessions that were happening.
Yeah, because we're not just talking about a few hours anymore. Weren't some patients on their stomachs for, like, really long periods?
Oh, yeah, we're talking like really long. There was this study, I think it was by Walter and their team, and they looked into this specifically. And what they found was that even sessions lasting, get this, up to 39 hours, it didn't necessarily lead to more complications.
39 hours. That's almost 2 days. I can't even imagine.
Right. It sounds kind of crazy when you think about it, but in some ways, those longer sessions actually made things a bit more efficient.
Interesting. Though I have to ask, I mean, we all know that feeling of, like, your arm falling asleep if you lie on it too long. So I can't even begin to imagine what it must feel like to be in that position for that long, especially when you're already so sick.
Oh, absolutely. And it's a very valid concern. I mean, you're talking about people who are already in incredibly vulnerable states. So, of course, with those extended durations, you have to be really, really careful about potential downsides.
So what were some of the concerns? What were doctors watching out for?
Well, the big one with extended PP is the risk of pressure ulcers.
Pressure ulcers, right? Those bed sores that can develop.
Exactly. And it's tricky, right? Because on the one hand, you've got the potential benefits of PP, which we've talked about. But on the other hand, you have to weigh those against the risks, and pressure ulcers are a serious concern.
So how do doctors decide? Like, what factors go into making that decision about whether or not to use PP, especially for these longer durations?
Well, that's the million-dollar question, isn't it? And the truth is, it's different for every patient. It's all about personalized medicine, figuring out what makes the most sense for each individual case. But generally speaking, there are sort of two main schools of thought when it comes to extended PP. Some people, some doctors, they advocate for this fixed duration approach, kind of like what we saw in that Walter study, because it makes things a bit more predictable.
Right, like a standardized protocol.
Exactly. But then others, they prefer a more, I guess you could call it a clinically driven approach, where they're constantly reassessing the patient, seeing how they're responding, and adjusting the duration of the PP accordingly.
So it's not as simple as just saying, okay, prone positioning is good, let's do it for as long as possible.
Not at all. It's way more nuanced than that. There's a lot of factors to consider. And the research is still evolving, which is exciting. Like there's this other study by Olkin and their team, and they actually found that, get this, longer PP durations might actually lead to even lower mortality rates.
Wow, so the plot thickens.
Right. It's like the more we learn, the more questions we have. But that's the beauty of science, isn't it?
Absolutely. Well, this has been an incredible deep dive. We've covered so much ground. As we wrap up here, what's the one big takeaway you want our listeners to walk away with?
If there's one thing I want to emphasize, it's the importance of communication, especially when you're talking about, life or death situations like this. Don't be afraid to ask your doctors questions, to get second opinions, to really understand the potential benefits and risks of any treatment, especially something like prone positioning.
That's such an important reminder. It's so easy to feel overwhelmed in those situations. But knowledge is power, right?
Absolutely.
Well, on that note, a huge thank you to you for walking us through all of this. It's been incredibly insightful.
It's my pleasure.
And to our listeners, as always, thank you for joining us on this deep dive. Keep those brains engaged, keep asking those tough questions, and we'll catch you next time.